is a masseter dominant bite, and we call it the distraction bite. So if you're for some reason deciding to do the masseter dominant bite, we already know usually it's not going to be your go-to bite, but it could be. So establish the vertical dimension. We're going to short circuit this a little bit by knowing that she's got her correct vertical was 4. So we've smooth side against smooth side, we have 4 shims. And we're going to take the 4 shims and extrude the material just as we did before. So we will put this on incorporate the projections and then do the same on the other side. And open, please. Close. Good. Now we're going to wait our requisite 50 seconds for the bite material to set. And as we did before, have a pencil. Thank you. We're going to identify the midlines, upper midline, lower midline, and these shims are nice. They mark right on the plastic. These are polypropylene. And 14 seconds left. This 50 seconds is only a long time when you're waiting for it to set because you have film running. Otherwise, it's very fast 50 seconds. You have to move very fast because otherwise the material does set rather rapidly. Okay, so now pencil again, please. And you take the mirror, please, Gloria, and protrude as much as you comfortably can. That's it. Keep them in line. Is that it?
Mm-hmm.
Okay, fine.
All right.
She's got it. And we mark the midline again. Keep the crosshairs lined up. You have the vertical crosshair. You've got the lateral crosshair. Keep the mirror on it and do it. This time, what we're doing is we are only extruding material into the molar section. We're not connecting to the shims at all. We're extruding into mainly the second molar. You can let a little extrude to the first molar area, and that's it. So if you want to, if you can come in close and see, there's a lot of space between the shim and the molar segment. When this is set, what I'm going to do is have her open. I'm going to take my fingers. Is it set? No.
Not yet.
All right. I'm going to take my fingers and I'm going to hold the posterior segments so they don't move. We'll ask her to open just enough that she can release the anterior segment here. And so we'll wait a few seconds. Because Maricela forgot to set the timer, which happens to even the best assistant, and she is the best assistant.
Mm-hmm.
So, there we go. So now I'm going to hold these in place, and you're going to release just enough. Perfect. That's it. Now, bite in there, and give us a good, firm bite. Make sure you got enough material. And the bite registration of the material that I find works the best is vanilla bite registration by discus. I find that the other materials, they separate too easily from the plastic. They break up too easily. Now, what I'm going to do again to start out, just to make the point, is I'm going to extrude it overlap the posterior segment for security, and then I'm going to extrude this. And you can take your tongue, Gloria, and sort of make sure that it doesn't just go anywhere at all in terms of your mouth. Again, coming over to the left, extrude it outside and extrude it. Now, if you can close your lips, fine. Now, we're making sure that it doesn't extrude too far. We're going to have a nice registration of the incisal and occlusal edges. And now we'll wait for it to set. The point about this bite that's very, very nice is that we've distracted the jaw joint. We have a vertical distraction bite, and when she bit down, because there was nothing in the front and she exerted the force, it's a masseter dominant bite. And so at certain times you're going to want to have a masseter dominant bite. Most of the time it will be the temporalis dominant bite. It's an easy bite, and it works. That's the other reason. When you have problems, or you see certain types of people, and as your experience gets more and more, there may be times you will want to start with the masseter dominant bite. But it's nice to have more than one technique when you need it. So if a patient comes in and that patient is saying, you know, I'm just not comfortable in this. It hurts when I wake up in the morning. I hate this thing. You might want to just say, well, listen, let's try this in a new bite and make it over. But record the bite. And then again, you look like you know what you're doing, and you do know what you're doing because it reflects a certain knowledge of temporomandibular disorders and jaw function and muscle physiology and muscle function. And as I say, it works. It works. Okay, and this stuff here, as you see, when it sets, it's hard. And this whole thing holds up. I really and truly believe that the other bite materials that happen to be blue in color don't adhere as well. This thing here is one solid mass, and certainly the lab can mount the case on an articulator with this. So I'm just checking to see which is the upper and the lower. I think I got it right here. And Gloria, if you'll just open, we will close, find it. Is that comfortable? Mm-hmm. Okay. This is the distraction bite, and this can go to the lab just like this. Any questions?